Bipolar disorder. Bipolar disorder is described as having stages of mania or exaggerated emotions cycled with depression. So the times are variable and it may be different depending on the person. The diagnosis can be delayed depending on the severity of the symptoms, and sometimes it can be misdiagnosed as a different psychologic disorder. Causes of bipolar disorder include genetic, medications, and stress. Therapeutic effects of bipolar disorder medications include decreased cycles of mania or depression. Indications including bipolar disorder and depression. Bipolar disorder medications has many drug interactions. The side effects that you have to remember specifically for lithium include headache, GI upset, confusion, tremor, seizure, and cardiac dysrhythmias. Some nursing interventions include assessment of therapeutic effects as well as side effects following therapeutic drug levels and fluid volume status. So specifically lithium, it can be dehydrating. Therefore, it is very important for patients on this drug to be properly hydrated. It is also very important to recognize the stages or poles or extremes of the symptoms. So how depressed are they? Are they overly depressed or are they overly on their manic episodes, as well as triggers? Patient educations including educating them about their disorder, the management of their triggers, and definitely it is very important to facilitate counseling. These are the drugs under this class, and the drugs that you have to remember are lithium and tegretol or carbamazepine. So lithium is one of those drugs that we have to monitor for the therapeutic drug levels, and for lithium we have to be within 0.5 to 1.5 milliequivalents per liter. Now tegretol or carbamazepine, on the other hand, the therapeutic level for this drug is 4 to 12 micrograms per ml. Parkinson's disease. Parkinson's disease is basically a degenerative CNS or central nervous system disease. It occurs because of the death of the neurons which produce dopamine. As we recall, dopamine helps to regulate movement and emotional responses. Signs and symptoms of Parkinson's. So first, we have to remember that Parkinson's is very common among men and women greater than 50 years old generally. Statistically speaking, it is more common in men compared to women. So the symptoms that we usually notice include tremors, muscle rigidity, bradykinesia or slowness of movement, postural instability or gait problems, dyskinesia or difficulty performing voluntary movement. At times, it can also co-occur with anxiety, depression, and dementia. Therapeutic effects include increase in dopamine or dopaminergic and or decrease in acetylcholine or anticholinergic effect. Indications include Parkinson's disease as well as restless leg syndrome. Precautions and contraindications include close-angle glaucoma because these medications can increase intraocular pressure. In addition, this can interact with phenytoin, haloperidol or haldol, and vitamin B6. Side effects of these drugs include syncope, rhinorrhea, abdominal pain, uncontrolled body movement, nausea, vomiting, constipation, and increased heart rate. As you may notice, these are basically the anticholinergic effects. Nursing actions include assessing for therapeutic and side effects, also making sure that we do a thorough physical and mental assessment of our patients, ensuring safety, definitely fall risk precautions, as well as swallowing evals or basically aspiration precautions. And we have to remember that these drugs, similar to the antidepressants and anti-seizure medications, these drugs must be tapered because of possible rebound symptoms. Patient education, definitely we need to inform them about the drug itself, the psychological effect of these drugs, as well as the presence of certain support groups that's pertinent to their diagnosis. So different classes of medications for Parkinson's include dopaminergic, dopamine agonist, and anticholinergic. Dopaminergic are basically dopamine replacement drugs. The drug to remember under this class is Sinemet or levodopa-carbidopa. Dopamine agonist, the drug to remember is Requip or ropinirole. On the other hand, anticholinergic, the drug to remember under this class is Cogentin or benztropine.